Hi, my name is Regina Pulley, and I'm a diabetes care and education specialist. And today I'm going to introduce to you Julie Terry, who's supervisor of cardiopulmonary department. She's going to talk to us about exercise. Julie?
Well, when we think about ways to treat diabetes, diet and exercise often come to mind. And while those are very important to help you stay healthy, regular physical activity can help you control your blood sugar levels and prevent complications. Physical activity helps reduce blood sugar by taking glucose out of the blood to be used by the muscles for energy. And it also makes it easier for your body to use its own insulin. Now, exercise and physical activity have other benefits too, including reducing the risk for cardiovascular disease, weight loss, reducing stress and feelings of depression, and it also helps with sleep. An important thing to remember is that any physical activity is beneficial, and nearly everyone can perform some type of exercise. For those who have difficulty standing or walking, stationary bicycles or mini exercise bikes are great options. The mini bikes are fairly inexpensive, and many can be used to strengthen the arms as well as the legs. Water aerobics is also a good choice for those who have mobility issues, joint problems, or chronic pain.
That's a good point that you make. What are some other options that people with limited mobility can do?
Right, so for people with balance issues, they can stand behind a chair and hold onto the back of the chair and just march in place. Other choices would be strength training exercises, and right here I have some exercise bands, and these can be found online or at many stores and exercise places. The different colors represent the different levels of resistance. So for instance, this yellow band here is very easy, it's very stretchy, while the green is a little bit harder. I would suggest start with something easy and then working their way up to a more difficult strengthening exercise. But these bands can be used, for example, place this around your back and you can do this. And this is a very simple exercise that works the arms. A lot of times people tie these onto a post or a doorknob and they can do more activities, or you can even tie these so they're a loop and put them around your ankles and do some strengthening exercises of the legs.
Good point. Good point.
Right.
Yeah.
And besides the exercise bands, there's many things in your home that you can use for strength training if you don't have hand weights. So for instance, you can take a water bottle or canned goods.
I have recommended that
Yes.
to some patients.
Right. And you can do some bicep curls. And if you want to get into something a little bit heavier than this, right here we have our detergent bottle, and you can use these. These are a little bit heavier.
Okay.
Now remember, building up muscle helps the body to use more blood sugar, both during your exercise and even whenever you're doing your normal everyday tasks or activities. But for those people who have increased mobility, walking is one of the best exercises that you can do to help keep your glucose under control. Walking does not require any special equipment. It can be done nearly anywhere. But before you begin an exercise program, it is a good idea to consult with your primary care provider. In addition, when starting a walking program, you should start slowly. I recommend 5 to 10 minute sessions and add a few minutes every week until you build up to about 30 minutes per day. And this can be divided into 10 to 15 minute sessions, so you don't have to do all 30 minutes at one time.
I do think people struggle with that when they think it has to be all at once.
And it does not, right. You do get the benefit of the exercise on your health by splitting it up into those 10 or 15 minute sessions. Also start with a slower walking speed and gradually build yourself up from there, from week to week. Now, the best benefit for heart health, weight loss, blood sugar control is walking at more of a brisk pace. At this intensity, your breathing will increase as well as your heart rate. The American Heart Association recommends about 150 minutes of aerobic activity per week for heart health.
Okay.
And people often ask, how do I know if I'm working too hard while I'm
I was
exercising?
just going to ask you that.
Right.
Yeah.
I get that asked a lot. And a good rule of thumb is this: if you cannot carry on a conversation with the person next to you,
Okay.
then you need to slow your pace or slow your level of intensity. Let's talk a little bit about strategies for success. So I recommend choosing activities that you enjoy, because who wants to do something that they
Right.
don't like doing? It's not going to last and you won't be successful. Find an exercise partner, and that person can help keep you motivated. And let's face it, it's more fun exercising with someone else. Keep track of your progress. So keep maybe a diary or a journal of what you're doing every day, and set goals. And whenever you reach those goals, reward yourself, maybe with a special dinner out or a shopping trip. Now, Regina, the next thing I want to talk about is exercise and hypoglycemia. Now, there's always a chance a person could experience low blood sugar levels either during exercise or after exercise. But this typically occurs more in type 1 diabetics, or in patients that take insulin or medications that cause the body to release insulin, such as glyburide. For diabetics who take metformin only for their diabetes, or who are diet controlled, we rarely see these significant drops in blood sugar, but there are a few simple rules you can follow to prevent low blood sugar levels with exercise.
And this is a good point.
Yes, the first thing you can do is make sure you don't exercise on an empty stomach, and that's a pretty simple rule to follow. The second thing is take your blood sugar before and after exercise, and don't exercise if your blood sugar falls less than 100. Is that what you agree with also?
That's definitely what I recommend too, especially the patients on insulin.
Right, okay. And if you have symptoms of hypoglycemia, which would be feeling shaky or headache, irritability, hunger, sweating, if you have any of those symptoms, you should stop exercising and go ahead and treat that with a rapid digesting sugar source, such as 4 ounces of orange juice or 4 ounces of regular soda. Another good choice is glucose tablets or hard candy. Now, this would not be sugar-free candy, it would be regular candy. And chew a handful of those to help bring the blood sugar up rapidly. And then check your blood sugar again. And if you haven't reached that 100 milligrams per deciliter, you want to go ahead and treat 15 minutes later with another round of orange juice.
Great advice.
And once your blood sugar rises above 100, then you can resume exercising. It's a good idea to carry a sugar source with you if you're out walking alone, or even if you'd be going to the gym. And again, that hard candy or those glucose tablets are great because they don't melt. They're very convenient to put in your pocket. Another thing I want to talk about is safety with exercise. Wear comfortable shoes and socks, and I'm sure you say this often to your patients. And after you exercise, you should be checking your feet, looking at the skin of your feet. You need to look for areas of redness, or blistering, or abrasions. And if you notice that, you should stop exercising until those areas heal. And you may need to switch your tennis shoes to something else that are a little more roomier, and they don't rub your feet quite as much. Another thing is to wear a diabetic alert bracelet or a medical alert bracelet or necklace to let others know if something would happen that you are a diabetic. And of course, as we tell all of our patients, if you notice any kind of chest discomfort, you're overly short of breath, dizziness, or palpitations, it's a good idea to seek medical care immediately.
Absolutely. So I just wanted to thank Julie for doing this presentation. I want to remind everybody that we'll have some links on the website connecting you to different things that the cardiopulmonary department has, and also that St. Jenna started a walking group. If you have any other questions, feel free to reach out to us. Thank you.
Thanks.